We do offer oral surgery in our practice. Often patients are told that they need to have their wisdom teeth removed, or certainly also evaluate other needs such as dental implants and bone grafting and gum grafting. My training includes being able to apply all of my education towards those services. But the way we do it here at Infinite Smiles is a little bit different. Normally, when you go in for these procedures, the surgeon makes decisions in the middle of the procedure, and often the patients are unaware as to what needs to happen. And there's a discussion that's had where the surgeon says, well, I'm not sure how much bone you're going to need, but once I get in there, then I'll know. And I smile because I think about that, and I think about if I would ever go through that process, not knowing exactly what needs to happen, and that uncertainty of going through a procedure and having the surgeon make those decisions in the middle of surgery. I am one where I would prefer to know ahead of time. And so we've integrated technologies into Infinite Smiles that honestly tell our patients and allow me as a surgeon to see what needs to happen before we actually do the surgery. And it's comforting. It's comforting for me as a practitioner. It's comforting for my patients to know exactly what's going to happen. And we utilize technologies such as cone beam, which is what I'm really known for, where we can see the patient's anatomy in 3D and appreciate every minor detail and virtually simulate the surgery that needs to happen so that patients feel comforted knowing that we can be minimally invasive in our techniques because we can see everything before we do the surgery and know exactly what needs to happen and predict what needs to happen so that there's no surprises, and eliminating the surgical mishaps that can happen. We try to refine the dentistry using these digital technologies, and that's where I see dentistry going in the future.